I'm a neurosurgeon, board certified. Our patient we're going to be operating on today traveled to us from Missouri. And he was involved in a motor vehicle accident. He was in a car wreck 4 years ago. As a result of that car accident, he's had back pain and neck pain. We fixed his lower back earlier this week with our Deuk laser disc repair. Today we're fixing the neck problems. We've already done his facet joints in an earlier surgery. Now we're going to focus on 2 herniated discs in the neck. He opted for laser spine surgery. He had a choice. He could have had a fusion done, such as an anterior cervical discectomy and fusion. He could have had artificial disc put in. But both of those surgeries are very invasive, have high complication rates, and a high rate of adjacent segment disease. As a matter of fact, the reported adjacent segment disease rate for both surgeries, ACDF fusion and artificial disc, is 25%. Adjacent segment disease is when you go and have one of your discs fused or artificial disc put in, and then within a few years you start getting symptoms from the next disc above or below. We call that adjacent segment disease, and it happens only with fusions and artificial discs. It does not happen with Deuk laser disc repair. So when we fix his disc, it'll be fixed permanently, and there will not be adjacent segment disease. Dr. Berndes, have you given him the medicine we need? Because it's time to do that. All right, folks, we're going to get started. Right approach, everyone agrees, C5-C7, C6-7. This patient has 2 herniated discs that are causing debilitating neck pain. Let's count, Jordan. Just look at the x-ray now. Switch over to the x-ray. 2, 3, 4, 5, 6, 7. You can see 6-7 is degenerated and spondylitic with some bone spurs. 5-6 is more of a herniation, less degenerated. If there are questions, feel free to type them up, and my team will ask me those questions shortly. Did we put on a nice face mask? Oh. Okay, good. Good. Tell me when to start. Any questions from the audience? Sean?
No questions.
2, 3, 4, 5, 6, 7. So I want to enter between the 2 discs. I want to enter over. Shot. I need to see the whole spine. Get rid of the front. Open it up. Shot. 2, 3, 4, 5, 6. Perfect. I want to slide down to 6, 7. Shot. Shot. Give me a AP view. Quick AP. AP is a front back view on the x-ray. Helps me make sure I'm centered. Lateral. Right there. Is that 6, 7, Jordan? 2, 3, 4, 5, 6, 7. Yeah. Sean? Good. Let's go with an AP. Shot. That's perfect on the AP. Back to a lateral. Shot. All right. Shot. 2, 3, 4, 5, 6, 7. I need another AP view. Try to center it up. It looks good. All right, lateral. Try to get a little bit more medial. Shot. Shot. It's kind of hard to tell on that lateral view there, but I think we're just coming into the disc. Yeah, it looks good. It's pretty collapsed. You guys see that? 2, 3, 4, 5, 6, 7. All right, we should be in. Good, that looks good. I'm going to go ahead and do a discogram. We'll inject some dye into this disc. You'll see a tear in the back of the disc, most likely. That's where all the inflammation is that's causing his symptoms. Shot. Shot. He's good. All right. Get the shoulders. Get one more shot now. All right, again. All right, one more time. Hold on. Shot. Shot. Perfect. All right, Jordan, show us this. Go to the x-ray view. Anthony, Kimmy. You guys see the tear in the back of the disc with the dye leaking out? That is the posterior annular tear, the source of his discogenic symptoms. Okay, in his case, neck pain, arm symptoms. Arm symptoms include weakness, numbness, tingling, and pain. There are 4 symptoms people get from pinched nerves in their neck. Weakness in the arm, numbness in the arm, tingling, paresthesia as we call it, and pain. In his case, he has weakness, numbness, tingling, and pain. There's one last symptom people can get from these herniations besides neck pain. They can also get headaches. The headaches that come from the neck are called cervicogenic headaches. Cervico is cervical spine. Genic is genesis or create. So headaches that are created or generated from the cervical spine. That's what a cervicogenic headache is. Any questions?
No
AP?
questions.
Shot AP? Shot AP? All right, we're right in front of the disc at this point at C6-7. I'm going to just take one more x-ray, make sure that we're in the center of the spine, and we are. You can see the tip of that dilator. Look how crooked his spine is, by the way. You guys see the scoliosis? That's from constant pain causing his muscles to tense up and just completely change the alignment of his spine. But the point is, the tip of the dilator is dead center, which is where we want it, in the front of the spine, right along the anterior longitudinal ligament. Let's show the audience the 30 different causes of neck pain while we I'm Dr. Deukmedjian, CEO and founder of the Deuk Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3, next is C3-4, C4-5, C5-6, C6-7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury to the capsule, will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Deuk plasma rhizotomy is the best treatment in the world available for painful facet joints. Deuk laser disc repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30. Welcome back. We are here at Deuk Spine Institute. We're performing spine surgery. We're live streaming so you all can watch and learn by asking questions of the surgeon and the team. This patient is under general anesthesia, completely asleep. He has general endotracheal tube, general endotracheal anesthesia, aka general anesthesia. We have to do that because to place the needle, I have to have the patient's airway very relaxed and secure. I have to have the pharyngeal muscles and the skeletal muscles in the neck have to be relaxed. So we put our patients to sleep so that I can do their surgery. If you have questions, feel free to ask. We're streaming live on YouTube, Facebook, X. Any questions from the audience so far?
Yes, this one's from Philip from YouTube.
Hi, Philip. Welcome.
Doctor, on a Deuk laser disc treatment, what happens to a collapsed disc? Does it grow back, or is it necessary to remove disc and do a fusion? Thank you.
Of course, Philip. You're welcome. To answer your question, the disc does partially grow back after this surgery. The part that grows back is the annulus. See, the disc has two parts. It has a nucleus pulposus and it has an annulus fibrosus. Now, the whole disc won't grow back, but part of it will. Some of it is able to regenerate once you remove the herniations. Okay? Great question. The Deuk laser disc repair that you're watching is the only surgery in the world that gives a patient a chance for their disc to repair itself. And that's why we call it the Deuk laser disc repair, because we're able to help the patient repair their own disc. But it requires first removing what's causing the pain and symptoms, aka the herniation, sometimes bone spurs. That's a bone spur you're seeing, and I've been removing part of it, and there's a lot of scar tissue here, okay? This is all scar tissue. None of this should be here. This is not normal at all for a disc. There's some herniation, the blue, more scar tissue, the white and gray, the bone spur right there. You guys see the bone spur?
Yes.
Should not be there. All this stuff is a result of his accident that he had years ago. And that accident caused a whiplash injury to his neck. As a result of that whiplash, he tore the disc, injured the disc. C5-6 and C6-7, two discs, matter of fact. And both of them are causing symptoms now, and that's why we're here, operating. Now, anywhere else in the world, he would have been recommended for a fusion or a hybrid surgery, ACDF combined with an artificial disc. And that's what I used to do. I used to do fusions, I used to do artificial discs. But patients want less invasive surgery. They want a surgery that has a higher chance of success, getting rid of their symptoms. And that's what Deuk laser disc repair is. Typical fusion surgery only in the best case can get rid of 80% of the symptoms. All right, ACDF or artificial disc. But Deuk laser disc repair, we routinely get 100%. So if you had to choose which surgery available for a herniated disc in your neck is going to give you the best result, the Deuk laser disc repair averages 99.6%, getting rid of your symptoms. 99.6. There's no surgery in the world that's as good. And if you go to the medical literature and look up results, okay? On the other hand, the second thing you want to look at is complications. What surgery has the lowest chance of a complication happening? Complications are bad things that happen during or after surgery, like infection or hardware failure, loosening of screws, loosening of an implant, adjacent segment disease, nerve damage during surgery, spinal cord damage during surgery. All of those complications, and that's just part of the list: pneumonia, heart attack, stroke, death. All of those complications happen quite frequently with fusions, ACDF, artificial disc replacement, okay? But we have never had one of those complications here with the Deuk laser disc repair. So intraoperative surgical complications, 0. So you want a safe procedure, this is it. You want an effective procedure, this is the most effective surgery in the world for a disc problem in your neck. A herniated disc or bulging disc or degenerated disc. And finally, you look at recovery, right? How long does it take to recover from this surgery? It's 1 hour. In 1 hour, this patient's going to be discharged. In his case, he's going to go to a hotel. And by the next day, he could go back to work. That's how quick the recovery is. If you have a fusion done, you're out of commission for months, if not years, okay, typically. Of course, that's not true if you have a fusion at Deuk Spine. Our patients go home the same day. And then finally, the last thing you people should be focused on is something called durability. What does durability mean? It means how long will these results last? We have long-term outcomes for our laser surgery that show patients that had laser surgery 6 years after their surgery still had an average of 95% of their back and neck pain was gone. 95%. There's no surgery in the world that gives you 95% at 6 years, except our surgery. So when you look at those important things like durability, safety, efficacy, this surgery provides patients with the highest level on all counts. As a matter of fact, there is nothing out there that even comes close, to be honest, in my opinion. And I've done 1,000 fusions and artificial disc surgeries in my career. All right, we've gotten rid of a lot of herniation, scar tissue, bone spur. I'm going to try to get a little more. But remember, this is a collapsed disc. This is a degenerated disc. Our goal here with this surgery or any surgery is not to make the disc look normal. That's not possible. When people ask me, will my disc look normal? The answer is no. There's no surgery on earth that will make your disc look normal unless you take a dead person's disc and put it in your neck. All right? And we don't want to do that. There's no reason to do that. You have a risk of rejection. And we don't do cosmetic spine surgery. Thank you, Dr. Berndes. So, long story short, what matters in medicine is getting rid of symptoms that are abnormal and having your result last for the rest of the patient's life. And safety. Don't create a new problem for the patient they didn't come with. And that's what our treatment does better than any other treatment in the world for a herniated disc. All right, any other questions?
No questions.
Let's show the audience how discs become injured and start causing neck pain, okay?
Disc injuries start with an annular tear. Damaged nucleus pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963. Disc injuries is a common cause of chronic neck pain. The inflamed annular tear causes neck pain. A 4mm skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes herniated disc fragments and debreeds the posterior annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349.
All right, welcome back. You can see from our sequence of videos that discs become injured through trauma. Trauma causes the herniation to occur, which then the herniation causes inflammation within the back of the disc. We call it posterior annular inflammation. That's what it is. That posterior annular inflammation then causes pain in the neck, headaches, and arm symptoms, but not the same symptoms in everybody. Some people have just neck pain, some people have neck pain and headaches, some people have pain in their neck and their shoulder with headaches. It's just different combinations. Next, let's see. We're going to move up to C5-6. So I've got to do the Deuk spine slide, or Deuk spine shuffle we call it, where I slide up the ALL to the next disc. Shot. Shot. I'm trying to just barely come out and then stay on top of the spine, which I did. And we're going to move north to the next disc, 5-6. Shot. AP. If there are other questions, I'll take them.
No questions.
Lateral. All right. Shot. Shot. Let's go AP again. By the way, the blood loss for this surgery is typically 5 to 10 drops of blood, which is virtually nothing. If you cut your face shaving or your leg shaving in the morning, you can easily lose 5 to 10 drops of blood. We've never had to transfuse a patient. Shot. Let's get another AP. It's very difficult sliding up the spine here because I think he has a little bit of scar tissue from his trauma. And that's just kind of lateral, kind of keeping me from getting up the spine, but we'll see. I seem to have gotten to where I need to be. 2, 3, 4, 5, 6. Yeah, his soft tissues have pushed me down. Shot. Jeez. Yeah, kind of fighting him now. Let's go lateral. AP. So I know the sucks is worn off. If I can't get this, I may have to redose him because I'm fighting his musculature. Let's see. Shot. That looks good. Lateral. Don't do it yet, but let me. I think I'm okay. I think I'm okay. Yeah, we're okay. We'll be okay. Hold on. No. Shot. Shot. We're okay. Let's just see if that's in the center, and then I'll place it. Any questions? Shot.
No questions.
I got to move. Stay there. Shot. It slid. Hold on. Shot. Perfect. Lateral. Because the spine is scoliotic, you guys can see the curve. It's making it more difficult for me. But that's good. We're right where we want to be. AP, one more time. So I'm going to be checking and rechecking, okay? Because all I have is this x-ray. I don't have anything else to guide me. Lateral, I must use the x-ray because I can't see inside his body. I just have a tiny incision since this is minimally invasive. So I have to use the x-ray to guide my surgery. All right, I'm happy with that. We use AP lateral views, which is biplanar, 2 planes. If I need obliques, I get obliques. Shot. All right. Now, this is the more recently herniated disc. Not as degenerated. Shot. And I'm going to see if I can get some dye to come out. Shot. There it is. Let's see if we can see that tear. Shot. You can actually see the tear. Shot. All right, look at that tear. Arrow. Look at the x-ray. Go to the x-ray. There's the tear in the back of the disc. You can actually see the herniation as well. Right there. No, you can leave them alone. I'm going to go right to the tear. You guys see how the tip of the dilator went inside the annular tear at the back of the disc? That's where all the symptoms come from. Now, we're going to do the whole surgery through this tiny little metal straw. It's called a tubular retractor or endoscopic retractor. There's honestly nothing in medicine that has more names for the same thing than a herniated disc. As a matter of fact, herniated disc has more names by far than any other condition or device in medicine. Okay? So I don't know why, but that's just the way it is. A herniated disc, which is very simple, is called a slip disc, a bulging disc, a ruptured disc, a protruding disc, an extruded disc, a herniated disc, a spondylitic disc. So we have 10 names for herniated disc. And different doctors use different names. Different country doctors use different names. But in the end, it's all the same thing. It's a tear in the ligament holding the bones together that allows the jelly from the center that's been fragmented into pieces from the trauma to squeeze out. Any questions from the audience?
No questions.
All right. Well, we are now at number 5-6. You can see some of the herniation right there already coming out. Grabber. We're going to use a grabber to remove some of this. I'll be done in less than 10 minutes, Dr. Berndes. If you have questions, this is the time to ask.
We have a question from Moon off X.
Noon?
Yes.
Nice.
How long will this surgery last?
Great question, Noon. This surgery is about 30 to 40 minutes. Everybody's a little different, but his will be about 30 to 40 minutes. We are literally going to be finished probably in about 5 to 8 minutes from now. So typically it's 10 minutes per disc once I'm inside the disc. This patient had 2 discs that are being repaired, so that's 20 minutes. Plus it takes me a little bit of time to get there, to place the needle and place the dilator along with the tubular retractor. But generally speaking, if you had to want to know the whole time, it's about 15 minutes on average. That includes preparation and access, surgical access to the area we're operating on. 15 minutes per disc. Now, unlike the last disc, this disc at C5-6 does not have all those bone spurs, okay? Look at this. This is just herniation right here. But there is some scar tissue indicating that his body has been dealing with this for a while. So he is trying to repair this thing for the last 4 years, but he hasn't been successful at repairing it. So he contacted Deuk Spine Institute off the internet. Maybe he knew somebody we operated on, very common, and they recommended us. So he came here with his father, and we fixed his back Tuesday, and we're fixing his neck today. Hopefully, we won't have to fix anything else. Yeah, they are. We get almost all of our patients come from other patients. So now this surgery you're watching, this is not an old type of surgery. This is state of the art. Look at that herniation that just came out. This is the most advanced spine surgery, in my opinion, in the world for treating a herniated disc or degenerated disc. The older style surgeries include ACDF, which is anterior cervical discectomy and fusion, or arthroplasty, which is artificial disc. Foraminotomy, laminectomy, those are all old style surgeries, but most surgeons still recommend those treatments because those are the treatments that they were trained to do. And they're not willing to change to do something better for various reasons. In my opinion, the most common reason is they're not trained to do this surgery, therefore they're not going to recommend it to you. But here's the thing. My loyalty is not to the surgeons. My loyalty is to patients. That's why I became a doctor. So I believe if your doctor is not going to offer you the best surgery in the world for a herniated disc, then you need to offer it to yourself. And the way that works is you just have to get a second opinion with Deuk Spine. We offer a free MRI review. And if you qualify for this procedure, we'll do it. Okay? We want people to have a better surgery and better outcomes. That's our goal. We don't want people to have to be forced to do old style surgeries that are dangerous and don't work well. There's a piece of herniation I just pulled out. Now, each of these pieces of herniation, they're small. You guys see this? Use the camera. Eye in the sky.
Yes.
It's only about 5 millimeters long. But, you know, it doesn't look like much. But inside it looked big, right? Because we use a camera and an endoscope with a lens system that basically magnifies everything, makes it look big. That way I can be more precise. You need that magnification and illumination for precision. That's what a sniper does. A sniper uses a scope when they're targeting and shooting, right? They use a scope that is a system of lenses. And they sometimes have illumination or magnification. Illumination along with magnification. Now there's a bigger herniation. Look at this one. Check this out, folks. Can you see this? This is important. I want to show you something here. I talk to you all the time, and you only hear it here at Deuk Spine, because other surgeons don't understand this. Look at this piece of herniation I just pulled out. That's a big one. It's almost a centimeter. But look right there. It's got red color. That is inflammation. What I've been telling you about surgery after surgery after surgery for the last 20 years. The body is trying to get rid of it, but it cannot. The inflammation cannot get rid of the herniation. So when people ask me, Dr. Deuk, can't your body get rid of the herniation? The answer is no, it cannot. All it can do is attack it, and what that attacking does is it creates more pain. More pain and more suffering for the patient, more symptoms. Here's more pieces of herniation right here. We're going to get them all out. We just float them out. There's another piece right there. Any other questions?
Yes. This is from Moon from X. How
Hi,
long
Moon.
does the surgery results last?
Yeah, Moon, great question. You always want to know that. The surgery results for this surgery are permanent, the rest of your life. So if you're going to have this surgery and live for 35 years after, you're going to have pain relief for 35 years. The first year, about 1% of our patients will re-herniate themselves. They actually don't listen, don't follow the restrictions, and they go out and do something. So what could you do to re-injure this disc before it's healed? Number one, heavy lifting. That's the one thing that when I see people come back with a re-herniation, which is 1%, 1 in 100, they have lifted something very heavy. You know, they thought, oh, my neck pain's gone, my arm pain's gone, I feel wonderful. 1 minute, Berndes. And they're like, oh, I can, you know, go back to playing football, rugby. I can help my friend move out of their apartment and lift their furniture with them. You know what I mean? So they end up doing something that re-injures their disc. But if they just listen, if they just follow the instructions, then they will not re-herniate and they will not come back. So when you ask about durability, it's a lifetime of relief. This is a permanent fix because I'm working with the body to fix a problem that the body just can't fix on its own. So I'm helping the body fix it by getting rid of the herniation and debriding the tear. This is an annular debridement. That's really what we're doing here, debriding the annulus. Okay, we're not taking the disc out, so we're not doing a discectomy. We're just doing an annular debridement. And that fixes everything. Any other questions?
Yes, this is from Moon from X.
All right, before you ask the question, I just want to show you guys this dilator. We're done. So he's asleep. He's covered in our drapes that are sterile. This is like any other spine operation. It requires sterility. And the entire surgery was done with this 4mm incision. Okay, I'm going to show it to you in a second. So I just took the tube out. Okay, we're going to hold pressure for a second. And I'm going to show you how tiny this incision is. But you can see my finger. That's my finger, right? One finger. I'm just holding pressure till the oozing stops. I'll take the question while I'm waiting.
Yes. Can you work on C1 and C2?
Can I work on C1 and C2? I can work on C1 and 2, but not endoscopically. C1 and C2 do not have a disc. C1 and C2 have what are called lateral masses. So they have a different kind of joint that's not a disc. They have a diarthrodial joint with a synovial membrane and a cartilaginous surface, along with synovium and synovial fluid. So C1, C2, different kind of joint. So I can work on it, yes, but I cannot do endoscopic laser surgery on it. We have a different type of treatment. All right, any other questions?
No questions.
All right, thanks for joining us. I'm going to show you the incision. Check it out. Here it is. It is literally 4mm. You guys see that? It's so tiny. Like literally a few months from now, he won't be able to see it. All right, thanks. Let's show our audience one of our patients who had this surgery done. And good morning, I'm Dr. Deukmedjian at the Deuk Spine Institute. I'm here with my patient who traveled to Deuk Spine Institute with a couple of problems. She had neck pain from a herniated disc and facet joints, and we fixed both yesterday. She's here less than 24 hours after her surgery. She went home, back to her hotel with her family afterwards, and she came back in for a quick checkup. You can see the incision for her surgery is 4mm. It's tiny. How do you feel today?
I feel good. A little sore from surgery, but that's normal. I'm so much better. I could just feel that I've been fixed, and that was not gonna happen without you.
Well, how did you hurt your neck?
I got into a motorcycle accident back in October, and it flew off the bike.
And you've been suffering since then?
Yeah.
Why did you decide to come to Deuk Spine Institute?
Do you have enough time?
Sure.
I came here because I was told that I had to have this really invasive surgery. They wanted to do a discectomy.
And fusion.
Yeah, and I was very scared. I was very scared, especially after reading what could happen, the risks. It was just too much, and actually kind of scary, because when I looked into the doctor, he actually had a lawsuit against him, which the people who suggested him to me were not aware of. So I kept doing my research. I thought, well, maybe I'll just figure out how to do some exercises to help my herniated disc, which, yeah, now that I know what I know, that's not gonna help your herniated disc. Nothing is gonna put that stuff back in your disc.
That's right.
So I did 6 months of physical therapy. That was unsuccessful. I still had pain in my neck, and it was really bad. I would turn my head anyway, and I would always feel the pain right here, feel the pain in my C6. I couldn't do the things I normally did. So when I did my research, trying to look for exercises I could do to help my disc, he popped up on my feed and said, "Do you have a herniated disc? I can fix you." And the more research I did, I was just so thrilled, because nobody has his impeccable record. No one. That's why I went to him. He knows what he's doing. He is crazy confident. His staff is amazing. They're so kind. They're so attentive. The lady that did my IV was so gentle. She did it, and I was like, "You're done already?" The people here are amazing. This doctor knows what he's doing. God has his hands in his hands.
Amen. We are so thrilled that you were able to get your neck fixed here and avoid that metal plate and the fusion and the discectomy, which is totally unnecessary, by the way. I'm trying to help people understand the truth. There's no need for ACDF fusions anymore for degenerative disc conditions. We can fix it with the Deuk laser disc repair repair and the Deuk plasma rhizotomy. You can see in your video here, we went into your disc, we used the laser. We actually pulled out several big chunks of herniation. I don't know if you watched your surgery, but you could see them coming out from the back of the disc. I cleaned the back of your disc beautifully, got the foramen opened up. There was nothing in there when I was done. Now your disc is going to heal naturally without any problems. Is there anything you want to tell the rest of the world out there that you haven't already said?
If you're in any kind of back pain, any kind of neck pain, he's the only option because he knows what he's doing. Really, he can help you. He's helped people get out of wheelchairs. He's helped people be able to ride horses again. I mean, I'm gonna be able to go back on a jet ski. I'm gonna be able to go back to my life. Obviously not right now after my healing time, but I wasn't gonna be able to have that happen before. And I'm an adventurous person. So if you're an adventurous person, if you're in pain, if you want your life back, you need to come here. You need to come here. You will never regret it. You will never look back. I promise you with all of my heart. He's the one you need to be with.
Well, congratulations on taking the faith and getting it fixed.
Thank you. Thank you so much.
You're welcome.
You've made me so happy.
You have a beautiful family. Please tell your husband I said hi. He's a very smart man.
Absolutely.
And I'm very happy you're doing well.
Thank you so much.
You're welcome. All right, take care.
You too.
Let's get you out of here.